You are very cautious and somewhat skeptical about the big headlines of the past week, right?
Yeah, these are extraordinarily preliminary data. So what we're waiting for is we're waiting for the big trial, which is to say the large prospective placebo-controlled trial where you have 20,000 people who get a vaccine, 10,000 people who get a placebo. Then and only then will you know whether a vaccine is safe and effective. And I would be really surprised if that all happened by the end of the year. You'd have to be really lucky. Also, remember, you want to have a representative number of cases of COVID-19 in the placebo group, and we're heading into the summer when it's likely that the number of cases will start to drop. So that also works against these trials, but we have to wait for those trials. Right now, these are extraordinary preliminary data, so let's be cautious.
Well, I know you respect Dr. Fauci. Do you think that maybe whether it's the president's optimism or is he too far out there, irrational exuberance, or do you think he's okay?
It's fine to be optimistic. It's fine to be aspirational. I think, though, that this process works in a specific way, and it's worked this way ever since the first vaccine was invented. We need to do the kinds of trials that prove to us that something's effective and prove to us that it's safe. What worries me in this is we're so desperate for a vaccine because we're terrified, paralyzed by this virus, that we might be willing to accept something less. And I think we owe it to the people in this country, especially remembering that most people who get this vaccine will be healthy young people who would be unlikely to die from this virus. We owe it to them to do the kinds of trials that we normally do to make sure that this is safe and effective.
And help with context. A lot of people, they just think, okay, once there is a vaccine, I go to my doctor, I go to a clinic, I get a shot, I'm good. I'm totally good. Stat News publishing an interesting article this week says, in the public imagination, vaccines are often seen effectively as cure-alls, like inoculations against measles. Rather than those vaccines, however, the COVID-19 vaccines in development may be more like those that protect against influenza, reducing the risk of contracting the disease and of experiencing severe symptoms should infection occur. So something that helps you but doesn't cure you, protect you.
Exactly right. So the protection may be short-lived and incomplete. By short-lived, I mean it may last for only a year or a couple years. And by incomplete, what I mean is that it would protect you against moderate to severe disease, but not a mild disease associated with reinfection, in which case you might still be shedding virus. So I think we need to, as we know more about these vaccines, we need to manage expectations so people can know what to expect when these vaccines roll off the assembly line.
Sun, fun, and coronavirus. How safe are we as summer pastimes beckon? Even in the great outdoors, epidemiologists warn nothing is without risk.
Everything that we do has risk attached to it.
This month, a report published by the Proceedings of the National Academy of Sciences said that when it comes to COVID-19, speech droplets generated by asymptomatic carriers are increasingly considered to be the likely mode of disease transmission.
It does appear that asymptomatic infection is a big driver of spread of disease, and we are still learning things about it every single day.
Anne Ramoyne is a virus hunter, a renowned UCLA epidemiologist who has spent decades researching in the Congo, trying to suss out the next virus and how it's transmitted. So far, this is what experts know helps stop coronavirus transmission.
Everybody should be staying as far apart from each other as they can and wearing masks, which will reduce spread of droplets.
But is 6 feet of distance enough? A new computer model suggests it may not be. An engineering professor's study of a computer model published in the journal Physics of Fluids shows a light breeze could carry some droplets as far as 18 feet.
Any data is important to be able to consider. We're literally gathering data in real time to understand what we're doing today and tomorrow.
It still isn't known how infectious those droplets could be if the virus is present.
Your absolute risk of getting it when there's like wind and you're outdoors is actually going to be very, very small.
The computer model has not been scientifically tested in real-life scenarios. What has been lab tested, how far droplets can disperse indoors. Think of summer vacation, airports, shopping malls, and restaurants. This is the National Institutes of Health's experiment. Normal breathing without a mask under highly sensitive laser light shows no droplets light up. But when you speak, droplets light up like a Christmas tree.
Ironically, one of the phrases that produces a large number of droplets is,
"Stay healthy."
And a cough indoors? Scientists at Florida Atlantic University showed without a mask, droplets can spread 12 feet. With a simple mask, the droplets still spread, but far less.
It's going to be 6 tonight.
Unfortunately for summer sports fans, enthusiastic cheering can also spew droplets further. The virus may move from one fan to another.
It loves the nose and mouth. It's like a 5-star hotel for the virus.
The cheering and high fives may defeat the effort to control the virus, which explains the idea for playing in empty stadiums.
A stadium is like an adult preschool.
But not all is lost. A dip in the pool, still cool. According to the CDC, there is no evidence the virus can spread through pool water. But self-distancing is still key.
We're going to be coexisting with this virus for a long time, maybe forever.
It looks almost like a normal school break at this school in Copenhagen, except for the police tape dividing the schoolyard. Just one of many measures meant to keep kids from bunching up and prevent the spread of the coronavirus, the head of secondary education says.
If you follow the guidelines given, if you keep distance, if you make sure to wash your hands, keep sanitizing, coughing in your sleeve and not in your hand and so on and so forth, I think we'll be safe.
Denmark started reopening schools more than a month ago, and so far, new coronavirus cases in the country haven't spiked, the government says. What's surprising, neither students nor teachers wear masks. Instead, they keep distance and wash hands and sanitize very often.
It's a bit challenging, but you get used to it after a time.
It's a different picture in South Korea. Children there not only wear masks, some are seated behind plexiglass dividers to prevent infections. Still, the country shut down dozens of schools after 2 kids tested positive. Even the first major coronavirus epicenter, Wuhan, China, brought kids back 2 weeks ago. Here too, masks are mandatory, and the school's president says other strict measures have been taken. We rearranged the facilities on the campus to ensure each class has its own restroom, he says, its own boiled water room, and its own alternative classroom. France reopened schools last week, but has already had to shut some down again after recording dozens of coronavirus cases. Still, France's education minister says he believes the kids are doing their part. The pupils understand the social distancing rules, he says, the wearing of masks, and in some cases, they show the way, including for adults, because they understand what's at stake. Denmark says it hopes to have all students back in school next week, but physical distancing rules means they don't have space for them all. So they are getting creative, moving some classes into local churches and even the church graveyard, all to try and ensure children can have their lessons even in times of pandemic. Fred Pleitgen, CNN, Berlin.